Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right, guys, I welcome everybody in this class tonight. It's a session on postcoital bleeding. It's a case presentation, and it's a very important and a very favorite of your examiners. It's going to be a long case that we're going to be discussing CS cervix, basically, mostly here. I took a class on the cervical cancer screening a couple of days back. Many of you attended that, and it was basically a prep for this particular session of yours. Okay, so why am I saying it was a prep is because tonight I'll be asking her questions right from the precancerous lesions, because the case is that of postcoital bleeding, and for that you need to be sure of what you are speaking and what you have heard, what you've seen, what you've known by the different flowcharts. Those flowcharts were taught to you on that day when we were taking up the case of cervical carcinoma, cervical screening actually. And this is based on NHS. So everybody who whoever wants to listen and learn the newer guidelines, it's the NHS guidelines 2023, which is RCOG. So 2023 guidelines have come up in which HPV gets the major role in detecting cervical carcinoma as a pre-invasive lesions. So we'll be basing our discussion on that. It's highly recommended to everybody to kindly see that lecture once again. Make your concepts, because in the exam, if they ask you, if you get an examiner like me, and if you get a case like this, and if you do not answer these kind of questions correctly, you can be messing up your viva. All right, so it's very serious topic. It has to be taken seriously, and that is why we are taking up this case in the light of everything. So her case is basically a growth, which is very obvious, but I'll be taking you through the journey of all these precancerous lesions as well, because that can be definitely asked in your exams. How many times do you really see a growth? You usually start with, apparently cervix looks normal, but it's a little unhealthy, and we'll go for a HPV, PAPS, and then colposcopy, and then CIN maybe, and then the whole journey. So I welcome Nikita tonight for presenting a case on postcoital bleeding. Over to you, Nikita.
Yes, ma'am. Thank you, ma'am. Good evening, ma'am. Good evening, all of you. So today I'm presenting case on post-coital bleed. My patient, Mrs. X, around 56 years old. She is 5th standard and she is a homemaker residing in the Bangalore, upper middle class. And I have examined her on the 5th of the March.
Okay.
Next. She came with the chief complaint of PV spotting after the act of the intercourse 3 days back. So history of presenting illness. She came with the complaint of PV spotting after the act of intercourse 3 days back. She had a history of PV spotting after 1 year of menopause for 1 to 2 weeks, and it was spontaneously resolved, not associated with the intercourse, and she has not consulted any gynecologist for the same.
Okay.
Not evaluated for that. And there is no history of taking a hormonal therapy. No history of difficulty in defecation, constipation, fissure or piles. No history of mass per abdomen or mass per vagina. No history of abnormal vaginal discharge. And no history of fever, night sweats, loss of appetite, loss of weight. No history of multiple sexual partners. And no history of increased urinary frequency, urgency, dysuria, retention. And no history of swelling in the feet, chronic cough or shortness of breath, chest pain or palpitation.
Okay, Nikita, just tell me, when the patient comes to you at 56 years of age with complaint of spotting PV after an act of intercourse just 3 days back, what DD comes into your mind? Which is why you've asked her the negative history, I'm sure.
Ma'am, first I will ask, as she is postmenopausal, so that she may be on any treatment like hormonal therapy. She may be, so that can be the cause, ma'am. And HRT or tamoxifen can cause the bleeding. And then if any local causes, ma'am, like
Yes.
local vaginal atrophy or erosions and cervical erosion, ulcer, or any cervical growth. Then ureteric any growth over
Urethra.
the urethra like that. That all the
Urethra, you
local,
mean, na? Urethra, you mean, not ureter, urethra.
yeah,
Anything
urethra,
local, any
urethra
local lesion.
divertical, local lesions first, and fissure and piles can also causes, ma'am. Like
Yes,
if
yes,
she,
yes. So, which is what is relevant also over here is how many times has she had this history? Is it the first episode? Has she been having this kind of history? What was it with you, Nikita?
actually she had a first history only after intercourse. This is the first time. Before that,
Mhm.
she was having unusual bleeding. That was 1 year after menopause. That was a postmenopausal bleeding. PV
Okay.
spotting was there. So one more time it was there, and this is the first time after intercourse. So there can be
Both the
local,
bleeding.
yeah.
Okay. Both the bleeding, I want to know the characteristic of these two bleeding. First of all, the bleeding that she had immediately after menopause was like it started after how long of the menopause? Was it that only 4-5 months had gone of no periods and then she had started having periods? What was the history? Tell me.
Ma'am, she was completely menopause. So 1 year of after the cessation. So after that menopause again 1 year. So total 2 years, ma'am. After that, she had only one time episode that lasted for 1 to 2 weeks. Continuous minimal spotting kind, not like a periods kind of thing.
Okay, okay. So any test was done at that time?
No, ma'am, she has not visited any doctor, ma'am. It was resolved
She did not
on its
consult
own.
any gynecologist. Okay,
Yes.
okay. So that means she never had any cervical screening even at that time.
No, ma'am.
Did she have any cervical screening ever?
No, ma'am, never. She has not gone through.
Okay, so this is a very, very important factor that she never had cervical screening. If you have such heavy, robust, programs running on cervical screening, how important the cervical screening has become, but she never had any cervical screening done ever. Correct? Is that true, Nikita?
Yes, ma'am, yes.
Even with that episode of complete, see, by definition, what is menopause? No menses occurring till at least a duration of 12 months, continuous 12 months. Okay,
Continue.
no spotting, no bleeding, nothing should have happened in between. And after that, if she had one episode of spotting, which was continuous at least for 1 to 2 weeks, and she has not consulted a gynecologist and it resolved on its own. So the fact is that if she did not get a PAPS, then at that time also, when will she anyways get the PAPS?
Yes.
After that,
Yes.
for 9 years, she was okay.
Yeah, after that she was okay, ma'am.
Okay. And this is the first time that she got a post-coital bleeding. So what was the nature of this bleeding? Was it like a flow? Was it too much? Did she soil the bed sheet? Did she soil her clothes? Did it keep on trickling, or did it just happen like a spotting and then it subsided on its own, or is it still going on? Tell me that.
No, ma'am, it was not like a heavy bleeding or anything, but she has not spoiled. But when she, after that act, she want to washroom, that time she feel that the bleeding is there. It was
Okay.
not heavy
Now,
bleeding.
okay. Now,
Spotting
Nikita,
only.
since she went to the bathroom and then she wiped and then she got to know it's bleeding, what
Yes.
can she mix it up with?
She can mix it up with Fisher piles, ma'am.
Yes, of course. So whenever they go to the loo and they wash or they somehow see the trickle of blood and all, it is not necessarily per vaginal bleed. Okay, it can be per anal bleed. It could be even urethral bleed. So that is the DD also that should come into your mind. Okay, nobody has seen her. Nobody, and she's not soiled the linen when she had this intercourse, which is what makes us even more, skeptical. There could be a bleed from any of these three orifices which are close together. So remember that always. Be very, very, this is basic common sense questions which we tend to forget during exams. That the examiner is sitting with a very open mind, but you are going and approaching a case with a very fixed mind that this is postpartum bleed and I will talk about CA cervix. Suddenly it goes into another direction when you go in for a viva. And that thing I'm trying to channelize your mind to have a very broader vision. Just step a little away from your case and see it from a broader perspective, that I am giving a complaint of post-coital bleed. Like in my last class, when we were discussing post-menopausal bleed, I told you do not restrict yourself only to endometrial CA or pre-invasive cancers of of the endometrium. It can be a cervical cancer also. Your viva will go in a different direction. You have prepared for endometrial carcinoma, but your viva is going in the CA cervix direction. So have a broader horizon. Okay. So post-menopausal bleeding is a very bad case to come for your exam. All right. So this is the reason why you've taken the history of hormonal therapy. I agree. defecation, constipation because you're thinking about piles, mass per abdomen because you're thinking that it could be a prolapse with an ulcer, maybe that is bleeding, right?
Yes.
Abdominal vaginal discharge. What all can abdominal vaginal discharge tell you?
Infection, ma'am. Any infection, and
Even a polyp will present sometimes with a lot of discharge. Vaginal discharge is coming all the time. Postpartum bleeding only at the time of intercourse. Otherwise, it's not bleeding. It's only contact, that it starts bleeding. All right. And by asking about fever, night sweats, loss of appetite, what are you anticipating here?
to rule out any cancer causes like CS cervix or endometrial carcinoma.
Yes. So it could
As
be
postmenopausal.
It could be basically when you're talking about postcoital bleeding, the DD that comes into your mind, apart from atrophic vaginitis and all, is any local lesion. Okay, it could be vaginal cyst which is suddenly bleeding. It could be a cervical polyp which is suddenly bleeding. It could be cervical growth which starts bleeding. It could be precancerous lesions of the cervix which because of the contact they start bleeding. So basically, it's lower. It could be piles. It could be urethral diverticulum. Okay, so this is the DD of postcoital bleeding, and with that thing in mind, you have taken her negative history. Now, history of multiple sexual partners is not very relevant for our case because she's a mother of 2 kids or whatever. And she's a postmenopausal female. You can skip this line, or you can write this down but not speak in front of the examiners. Okay, they'll unnecessarily point it out. All right. Now, anything specific for menstrual history that you remember apart from the episode that you told me? Anything else?
Apart from that, nothing significant. Her previous menstrual cycle was regular only, no intermenstrual bleeding, nothing was there. And she attained menopause 10 years back, ma'am.
And that was a smooth menopause. Did she have any problem? Was she subjected to some pills? Is she on HRT? Anything?
No, ma'am. Nothing like that.
It was a smooth menopause. You never had any problems. No heavy menstrual bleeding that time. No DNCs done. No biopsies. Nothing?
Nothing.
All right. Anything in obstetric history?
No, ma'am. Para 2 living 2. She married at 20 years of age, 36 years. So it was an early marriage. So it is a risk factor for pre-invasive lesion of cervix or CS cervix or HPV also.
Correct.
So that was an early marriage and previous to normal delivery, and she has not used any contraception, ma'am. No.
Is it important? Contraception history is important specifically for our case. Of course, it's important, but any relevance to that case?
Yes, ma'am. Barrier contraception, ma'am. If she is using that, then it will prevent the HPV infection and other STIs, ma'am.
Very good, very good. So she has any history? Usually, Indians, they have a history of barrier contraception use.
Yes.
Yes or no?
Yes.
Your case did not have, right?
No, ma'am. She is tubectomized, ma'am, 30 years back.